Hello, please subscribe and like for our channel. Thanks very much.
Now, the next question is case 4. You have a 7-year-old child that is brought to the emergency unit with a history of sudden onset dyspnea after eating peanut. Every time you hear sudden onset dyspnea after eating, particularly in a child, you think of an aspiration. Is it clear? And when they're asking you to interpret, the first thing that you have to go to look for, you go to look at the level of the right lower lung field on the chest x-ray. Is it clear? And in this case, you are going to have what you see, heterogeneous opacity at the level of the right lower lung field. Is it clear? And you have heterogeneous opacity at the level of the right lower lung field. Is it clear? That's the only thing that you have to say. And your diagnosis, and even the right, is even going at the level of the medial side, the level of the carina. Is it clear? So you say you have a heterogeneous opacity at the level of the right lower and the middle lung field. Now that's your interpretation, but just say right lower lung field. Now your diagnosis is aspiration pneumonia. Generally, you have to know that what the clinical presentation of a patient that has aspiration pneumonia is a sudden onset dyspnea and a respiratory distress syndrome. And respiratory distress syndrome consists of what? Consists of the first thing, the general appearance that the patient is going to be in respiratory distress. Is it, and how do you know the patient is going to be in respiratory distress on just general appearance? You see nasal flaring, you see intercostal recession, you see subcostal recession, you see abdominal movement of muscle movement. Is it clear? All that one tells you that the patient is generally in respiratory distress. Additional signs that the patient is going to have that show you that is respiratory distress is on vital signs, where you take the saturation, and the saturation is going to be less than 95% for standard medicine. But in the localities, the saturation when is less than 90%, that is said to be abnormal. Is it clear? So those are the different things that you have to understand particularly. And now the question that they are going to ask you is, why is it that when a patient aspirates a small object is going to enter in the right lobe? The answer is because the right lobe has the right bronchus is shorter and it is more vertical as compared to the left bronchus, which is longer and is more horizontal. Is it clear? So if a child eats aspirate a small peanut, actually I wanted to even see the peanut at the level of the big. Sometimes you may even see the peanut at the level of the right lower lung field. Is it clear? Where you require now to do an endoscopy procedure in order to remove that peanut to prevent local inflammation. Is it clear? So generally those are the things that you have to do. So let's go now to the next question. So those are the different things you have to understand. Now the last thing I want to tell you is, every time that you have aspiration of inside a large object at the level of the respiratory system, is instead going to close the carina, meaning it's going to close both of the lung fields. Is it clear? And you can have what is called a pneumothorax, because air is no more getting out and air is no more entering in. So there may be a burst of the lung. So you may have a bilateral pneumothorax in those cases. So you require to remove those peanuts via endoscopic procedures. So from here, we're finished with this tutorial.